Well, basically the rumour, and I know Gib is rife with rumours, that the care agency is going to merge with the GHA. I believe this started when Minister Arias-Vasquez made a statement in her budget speech about a significant restructure of the health and care services. She also said that she would be consulting both the unions and other stakeholders. Well, as far as we're aware, none of the charities or the NGO stakeholders have been consulted. It's a persistent rumour. We did speak to her. I spoke to her in person. She assured me that it was the administration departments only. The rumour persisted, so I wrote to her. Again, I was assured it remains as our conversation. But the rumour is still going, and it's getting worse now because it's now being said that there is legislation being drafted which will allow government to do this in one move. And what we need is for the Minister for Health and Care to actually come out publicly and say what's going on. Is there going to be a merger? Are they changing legislation? What is the situation? Because it's very worrying for families and service users.
If rumour is so rife in Gibraltar and the Minister has given you assurances already, why are you giving so much attention to this rumour?
Because basically a lot of time when rumours come about, you can speak to a minister and you can be assured. And you reach a point where you understand where
she has assured you, no?
Well, she's told us it's the administration, but what we are now on the understanding is that it's now going further, and that needs to be clarified.
And let's talk about what this would mean if it were to happen. Why is the Disability Society so against such a merger?
Well, because basically, first of all, they're huge departments, and the care agency, as far as disability services are concerned, I can't speak for other services, but we feel that it needs to be kept separate. We don't want to go back into a medical model of disability, which is basically where a disability is defined as a doctor's diagnosis, and it is what somebody's disability, physical or mental, that's their impairment. We like the social model, which basically means it's society that makes a person disabled. If you can't access a building in a wheelchair because it has stairs, that is a medical model. You are disabled, you're in a wheelchair, you can't access, that's your problem. But if you have a building with a ramp, then you're just like anybody else that can enter that building, and that is what a social model is.
Now, in your statement, you also state that the government is struggling with staffing levels at the moment. How do you know that?
Well, because a lot of our service users are in the services, and parents are obviously informed when staffing levels are dropped or they can't do a certain thing because they don't have enough staff. We do understand. It's not that unfortunately, and this is fact, that government are not prepared at the moment to give permanent contracts to people who don't live in Gibraltar. We understand that there is a big issue over the border, nobody knows what's going on, but at the end of the day we can't keep putting these things off. And having permanent staff on contracts working for the care agency is continuity of care.